Today, we're going to discuss how to present a patient in less than a minute. I'm hoping you guys watched Mastering Patient Presentation on a previous video that we actually did. And what this video works on is understanding how to interpret all the information that you gathered in your SOAP note. And so as surgeons, there are three things that we care about. Number one, what is the problem? Is it surgical or non-surgical? If it's surgical, number two, are they a candidate? What defines them as a candidate? Number one is, are they interested in surgery? Number two, are they going to survive surgery, which is based on their disease pathology and their medical history. Some people are too high risk that the risk-benefit ratio does not make sense to operate on them. And then thirdly, how are we going to perform the surgery? Again, this is dictated on the pathology and the skill set available for the surgeon and the patient's previous surgical history. By putting all of these things together, then you can make a good assessment and summary of what the concerns are and how to solve that problem. Other things that you have to understand when patient presentations are in concern, number one is there are three scenarios. First one is going to be in the emergency room or new consults. And whenever you get a new consults, which are inpatient, you have to make sure, are they stable or unstable? Since we are general surgery, there are things that become emergent for us, which includes bleeding, obstruction, perforation. These are things that we may have to operate urgently or emergently. And so that becomes your first question, if they're stable or unstable, and do they need surgery? And from there, you can work up the last three questions that we had discussed previously to summarize your presentation. For inpatient, I think the easiest thing to do is actually detail, especially for post-operative patients, are detail their operation and what is the indication of their surgery. And then from there, after that, that gives us a good summary of why the patient's here and where are they in the progress of their course. We're always thinking about patients going home. So are there any barriers to discharge? Are they eating? Do they have bowel function? Are they able to ambulate and take care of themselves? Or are they going to need a facility? Do they have adequate pain control? And are their comorbidities managed? Unless there are other complications to what we are working on, these are the things that we want to make sure and ensure. Other things you have to consider are DVT prophylaxis as well. Last scenario is going to be the clinic patient. Now, the clinic patient, most likely 90+% would be stable patients because this is an outpatient setting. And occasionally there are going to be some people we triage to the ED. But for the stable patients, we only go through the same three questions after doing your SOAP notes, which is, what is the problem? Is it surgical or non-surgical? And is the patient a candidate? And what type of intervention are we going to do? Are we going to do something open, laparoscopic, or robotic, or can it be done by IR or endoscopy? And so by that aspect, then this differentiates an intervention as an operative or if it's going to be a medical management. From there, you can start working on simplifying and understanding your presentation, which is like storytelling. You gather the information, interpret the information on what you want to convey. Please don't tell us all the things that the patient told you, but interpret them so that we would be able to pay attention to the highlights. For example, I got a 37-year-old male with a month history of recurrent right upper quadrant pain with nausea and vomiting. He has no medical or surgical history. Ultrasound finding shows cholelithiasis with no ductal dilation and normal liver function test. On examination, he has no jaundice, a soft abdomen, non-tender overall. And so the plan would be a laparoscopic cholecystectomy, and the indication would be symptomatic cholelithiasis. So it's very short and concise. And as long as you think about it, you basically answer those 3 questions that we talked about. And from there, whether you call the surgeon at 2 a.m. or talk to him at night, in the day, you're able to convey the information and all the important highlights which the surgeon would need. I'm hoping you guys find the tips helpful. And if you do, please click the like and subscribe button. Thank you very much.